international editor of the Cyber Express, and this podcast is coming to you from the Black Hat Security Conference in collaboration with Sriracha Catalyst. And with me today to discuss AI security and risk in healthcare are Willy Leichter, CMO of PointGuard AI, and Manmohan Singh, Deputy CISO at the UT Southwestern Medical Center. Welcome, gentlemen. It's great to be here with you.
Thank you.
It was a pleasure to be here.
Appreciate it.
All right. Willy, why don't we start with you? What are the most promising use cases of AI in healthcare, and where do you see the biggest risks?
Both are broad questions, and I think it's changing every day, which is one of the amazing things to try to keep up with. I think in terms of diagnostics and pharmaceuticals and testing, enormous possibilities. I think Manmohan's probably better qualified to speak to the specifics. I think there's a lot of areas of productivity gains, either real or perceived, that organizations are trying to use. Many of them make sense. Some of them we're not quite sure yet. But AI is incredibly compelling, any way you look at it. The risks, I'd say, are equal, and the pace of AI is a risk in itself. I think AI has descended on us so quickly. It's been around, but in terms of it being a FOMO thing for organizations, it's happened so quickly, unprecedented. The cloud happened quickly. This is happening 4x as quickly. So that creates risk. That creates the technology, the deployments, the ideas getting way ahead of the governance and the security. So we're seeing a lot of these emerging. There's a number of things we know we should be concerned about. And of course, there's the unknown, which is probably much larger.
Yeah, I 100% agree. I think the use cases are enormous, right? Right from patient diagnostics, there's a ton of use cases on how you can make diagnostics more efficient, right? Plus there's front office use case, managing the whole hospital admission process, the back end, your revenue lifecycle management process. So the use cases are enormous, so to say. The only advice I sort of give from a risk perspective is, and we sort of formalized it with like a risk oversight committee in our institution. So I recommend that's, security and kind of, other parameters obviously comes along with that process, and we're sort of working on formalizing that. But the key aspect is, and Willy sort of touched on that, is don't chase. I mean, we recommend as a part of that committee, don't try to do something which others have done, right? Don't chase AI, sort of curate it, right, in a way. So look at what you're doing, how you're doing currently. What is your operational pain point? And then what value is going to provide to the patient? Because again, in a health system, it's always a patient-first approach, right? So whatever you're trying to do, not just look at productivity, but also look at patient safety and say how that value is in there. So these are, some of those key principles we follow to ensure it's been looked at the right use case perspective, and not really trying to chase AI and say everyone else is doing it, so here we are, right? So I think that's sort of a key aspect I wanted to highlight.
I'll just chime in on that. Unfortunately, I think a lot of organizations are starting with where can we use AI, as opposed to where do we have pain points, where do we have inefficiencies where this might help. And it happens a lot, but that creates the wrong, backwards thinking, I think.
Yeah, really good points. Manmohan, how are healthcare leaders balancing AI's potential with operational and security risks?
Yeah, so again, the key aspect is, I'll say probably three key areas, right, where we sort of balance it. One is sort of really looking at value versus vulnerability, right? We are in an extremely regulated industry. Even though there's, as much as I would have hoped, we don't have too many regulations, so to say, from an AI perspective here. But the critical part is we're handling with some really sensitive data, right? It's a data which is entrusted by our patients to sort of safeguard, right? So the objective here is to kind of, when we look at it, and one of the challenges healthcare leaders have is to really kind of balance between what is the value we're going to get out of it, and then what is the vulnerability or risk associated, right? That's the key aspect I would sort of want to highlight, which comes as a part of that initial use case validation, right? And then obviously there are things like formalizing it in terms of what type of data are we going to use, right? Where are we going to share that data? What kind of model we will be building, right? Because there's a lot of, the age we live in is that a system itself won't do a thing unless you learn and take data and push data to 20 other systems, so to say, right? That's how sort of the ecosystem is built. But kind of understanding the intricacies of what type of data and how we're going to use it, and again, what is the value versus what is the risk, sort of balance it, and then really sort of take that decision point there. So
I'll just add in that a lot of the issues, even the underlying security threats, aren't necessarily new. There is a broader attack surface with AI. There's new elements. But we're seeing examples where AI is the entry point, and then there's a typical vulnerability exploited, or passwords weren't set up properly. We saw this with the cloud 10 years ago. Engineers suddenly just started putting data in the cloud in Amazon S3 buckets without password protection. Stupid security tricks. Also, lots of new potential regulations, but I think probably in healthcare, you can speak to this, but HIPAA, the existing ones, the existing privacy laws are still probably going to be dominant in terms of what we need to be concerned about, because it's data leak. From everyone I talk to, data leaks are still the first thing that comes up in discussions.
That's the prime concern. I would agree, Willy. Only a sort of additional aspect I had is on that context is yes, there is HIPAA, which is more like a baseline sort of a standard. So when we evaluate use case from a security perspective, we say, okay, if you look at HIPAA, right, the core sense of it is how you use, process, and disclose patient health information. So we still keep it as a foundation, but to Willy's point, right, the use cases are getting added in a way that it really exposes that information in the new gen technology of AI. So we are extremely crucial, or I'll say cautious, on evaluating those use cases, predominantly from a perspective that if it's a Gen AI use case with a human in the loop, it's still acceptable. But what we're really concerned about and kind of really evaluating it from a risk lens perspective, and when you're talking about some of those agentic use cases, right? Because the chances of going wrong there with the patient data, the risk is, multiple fold there. You don't want someone to read a scanned data and agentic sort of takes that decision to say, you're diagnosed with this, vis-a-vis it's probably not the case, or the other way around, right? So kind of evaluating that is, those use cases are critical there.
Yeah. Huh. What are you seeing as far as shadow AI goes? Are security teams getting early insight into AI deployments?
Oh, it's absolutely real. I mean, it's, at least for a, institution like us, we're a academic medical research center. So all those verticals of, academia part, medical center, and research comes, right? And people want to stay ahead of the game. So we have all the data in there, and there's, quite a substantial presence of shadow AI where researchers are sort of looking at and trying to build something on their own, right? But again, we're trying to put a wrapper around it, and with this, AI oversight committee, we're just ensuring that, hey, come on board, talk to us about this, right? We've put up a governance framework which ensures we, as in security and compliance, are much early to the process in terms of understanding and evaluating. But again, Paul, the approach really works here is that kind of working with them to say, we really want to be a seat belt rather than a stop sign, right? And kind of working with them and saying, we want to ensure what you're doing and guide you in a much secure way of doing it, right? Because typically, I think the model and why shadow AI or previously shadow IT was present, because they thought they're going to be slowed down with the whole process, right? So kind of working with them and formalizing through some governance documents, some standards we have put out in place. Education is key, right? And the whole shadow AI, telling them about what could go wrong if things are not built secure way. So, but it's an absolute real use case we see on shadow AI.
Yeah, and I would second that. Probably the first request we get the most from healthcare and other organizations is discovery. Do you have tools to tell us what's going on? There's also two sides to shadow AI. I think, lots of us using ChatGPT or other tools, their concerns are legitimate concerns that you want to monitor. But I think to your point, there are millions of open source AI models for almost anything you can conceive of, which are wonderful for researchers, for experiments, for testing things out. But the creep of those models into an environment, you have to have some controls. It's a massive supply chain challenge. If you look at Hugging Face, it's this open source site, close to 2 million models. Lots of malware there, obviously. Doesn't mean it's all bad, but you have to have controls, you have to understand where it came from, and you have to govern the supply chain like any other software supply chain. Except it's so much faster and more powerful. And it's natural, again, to your point, no one wants to say, don't use AI. That'd be like people saying, don't use the cloud 10 years ago. They're probably not employed anymore. You're going to use AI, and we should be. But if you don't need to have 100 models in the network, and you probably don't remember that you downloaded 100 models. You probably need 3 of them, and or you need to manage them, have visibility, and have governance over that is critical.
Yeah. Huh. Willy, let's stay with you for just a second. What are common patterns in AI adoption at the edge, and what do visibility tools do to help there?
Sure. So I touched on it a little bit. I think there are 2 parts to this. If you're talking about the network edge, SSE, there's a lot of traffic now that is AI related, and we can monitor those prompts and responses. Look for use DLP tools. Always a harder challenge than people want to admit. It's a perennial challenge. You can't just say categorically we are stopping any sensitive data from going in and out of our organization. But you can certainly have checks on health information. So that's part of it. But I think that also a big component is training and is best practices for users and awareness. I think you can't get around that. But on the build side, as I was mentioning, there is a lot more that can, infiltrate an organization, for lack of a better word. There's a lot of new tools, we have the DevOps, DevSecOps pipeline. Over the last decade, we learned how to bake security early on into development, into code. Now we're starting to think about AI SecOps or ML SecOps. We need the same process where it's part of your development process. And there are development pipelines within AI now that are in most cases quite a bit ahead of the governance structures yet. Hopefully not everywhere, but inevitably, if you're experimenting and testing and trying things out, you work with academia. You can't put constraints saying don't download this amazing new model, don't experiment it, but tell us and be careful.
Yeah, correct. Tell them the guardrails. So again, some of the risks are different, Paul, on this. I mean, it's like any other technology. I don't see how this has to be handled from a governance perspective is any different, right? I mean, any new technology comes in, there's always talks about, okay, how do we do? And, like people run around to say what controls we should have. I don't see that any different. However, the model you're taking for evaluating risk, that has to map to the new age technology, right? I mean, so AI introduces, it's not just about a piece of code or an algorithm you're writing, but how do you look at what controls you have for, model drifting or model poisoning? These are some new age, and we've seen some, use cases out there where, it started to behave not in an anticipated way. So what due diligence you do, how you threat model your, and do threat modeling based on what you've built. I think those are the key sort of parameters to focus on and get visibility on. So,
yeah, you mentioned threats. If I can jump in here for just a second, how is AI changing the threat landscape in clinical or operational settings? What are you seeing there?
Yeah, I think so. See, some of these new risks, as I was saying, right? So obviously your attack surface is expanding, right? You're looking at sort of new age risks, things like data poisoning or model drifting or not behaving in the unexpected way. So some of these threat vectors you're looking at now, it's very easy for someone to really come in, if it's not secure enough, to poison your model, and then your whole, whatever you have built sort of goes for a toss there, right? I was attending a conference and I was hearing someone talk about, some of those guardrails not having there. And I think this was a co-pilot use case, which is more like Gen AI than anything else. And then someone can just go and, if it was not with not the appropriate guardrails around it, someone can just go and put a prompt and say, can you show me email conversations between the CEO and CFO? With the lack of guardrails, he was able to give that data to an end user. So the risk is that initially you may have some information exposed, but it was just kind of hidden with not, people not having visibility to say, okay, how can they access that? Now, for bad actors or even your internal users, it is just a right query or a right prompt away, right? If they put in the right prompt with the lack of guardrails, it's gonna, give that data, push that data out.
Yeah, and I'll add to that, we're seeing lots of evidence of prompt injections as kind of the first easiest thing for hackers to try. Or it's not always malicious, but it's certainly an avenue for malicious attempts. And it's such a large attack surface, or it's potentially accessing so much information that there's a good chance that prompt, even if it isn't telling you that the secret, maybe it's revealing someone's identity. Maybe it's telling you where they work. Maybe it's telling you something about tests someone took. A lot of fodder that can be used for ransomware or for a lot of these traditional attacks. And I mentioned that at the beginning, that it's a new entry point. It's a new larger attack surface. But often I think we're going to see it come back to the same the same type of attacks or ransomware or destructive attempts that aren't necessarily the AI's fault, but the AI was in that attack chain.
Yeah, I agree.
Yeah. Are you seeing any risk from LLMs and autonomous agents, Willy?
Yeah, we're at an interesting time in the industry where we're just getting our head around LLMs from a security standpoint, and now agents are upon us. And I've been to a number of security conferences where I think the agentic issues are again accelerators, and the managing the identity of agents, and and what they can and can't do. Lots of things that we're going to have to get our head around. I don't think the agentic attack vectors are, well, I was going to say they haven't happened yet. We don't know, but I think we still have to get back to what we understand are the potential weaknesses with LLMs. And the agents are going to be exploiting those and doing it at larger scale. So I think the agents are another big scaler here of the potential attacks. But we kind of have to keep making steady progress on fixing the issues that we know that are endemic to AI, and then be prepared for agents to multiply everything.
I agree. I mean, one of the risks I see is, risk predominantly is, my view is on access and the permissions you give to the agents, right? Because previously when you were creating identities, right, you were very clear on what this identity would do, right? Go read this information, fetch this information, right? So it's not like they call it the NHI, right? The non-human identity. It's not a new thing. It always used to be there, like your service accounts and all of that, right? Now you're creating a bunch of, that whole NHI thing is getting exploded. So now you have agents going and kind of querying information and really doing the job of kind of, providing that required information. But what are the guardrails? I mean, if the whole compromise on those agent identities is concerning, right? Because now it has exposure or access to all the sea of your data. So if you're not appropriately, govern the access, you're sitting at a huge risk there, right? In terms of what someone compromises those IDs, that your agents is going to behave, in a different way, which is secondary, but that just gives a big entry point to like an external attacker to really have access to a lot of your information there. So.
And we have to think through this. If I have 100 agents, am I giving them all of my permissions? That'd be easy to do. That's probably the default. Then am I responsible for what each of those agents did? There's going to be some thorny battles around that. I think there's some good things emerging, like an agent naming service like DNS for a registry. I think we need a standard there. Each of these needs to have its own specific identity with zero trust or with least privilege. It's again things we know we need to do, but we have to treat these autonomous agents as entities that need to be carefully managed, just like every human, except there's going to be a lot more of them.
That's a good point. Actually, as a frontline guy, what do you do to balance the need for innovation with, with risk? What do you do to, where's the happy medium there?
So the happy medium, predominantly is again, sort of understanding what use case they are looking at, right? So we have sort of formalized, an AI intake request process, right? And I think it's important to do that because people will have their wish list and they go and attend a conference and here's this fancy thing, right? And then come back and say, we want to do something similar here, right? But sort of balancing that with saying, okay, what is the use case you're looking at? Describe that use case. Again, needless to say, there is no AI without a good data management posture, right? You need to know your data, where your data is going to sit, what type of data you're going to use it, right? What kind of modeling you want to do. So it kind of goes through an evaluation process internally as part of the committee to look at use case, what is, how it's going to impact. And again, we just look at beyond security. So I was alluding to this earlier. It's a very patient-centric approach, right? So whatever we're trying to do, how is that it's going to help our patients? Because eventually we are in an industry where if we make our patients' life much more safer, if we make our researchers do what they're doing in a much more faster, secure way, those are sort of more business parameters we evaluate the use case from, right? And then when it goes through the evaluation process, then obviously you look at, okay, what sort of guardrails you want to have. Because a lot of this, again, is built from a perspective of collaboration with other agencies. And you'll find this very common in a healthcare or an academic medical center research, sort of a setup, right? They'll partner with like other universities. So kind of understanding who does what, right? How are we going to use that data? Where are we going to keep that data? So kind of having these conversations really help draw what is the value. I was making the statements like value versus vulnerability, right? That's a key point for us to be, really evaluating those use cases and draw the balance. And then as a committee, and we have kind of a cross-functional committee, right? So from our healthcare leadership to research and academic and compliance and legal, everyone is a part of that. And everyone sort of chips in with their view, and then we sort of do more like a go, no-go discussion, decision based on that. And then as you go, then obviously you follow the process of ensuring, it's built within the guardrails defined, so to say. Yeah.
And I think, excellent answer. I think broadly, we can't stifle innovation. There are amazing things that can be done. We have to set up safe, environments, safe ways to experiment, to try these things out, because it's incredible what can be accomplished. But it has to be driven by needs and use cases that we understand and that we define. I've said this before, but I keep thinking back to the rush to the cloud a decade ago. And so many, with shadow IT, so many organizations were saying, no, you can't do this. You can't send a file. And so you say no, then people find a way around it. So you've got to have a, not permissive, but an environment where you're helping, the users do what they need to do and have some freedom. Again, particularly in academia, I'm sure it's very hard to say no, but you can say yes, but let's do it properly. Let's be careful.
Yeah. Willy, what does PointGuard do here to help accelerate AI adoption while maintaining governance?
Sure. So we have a number of things we do specifically around AI. I mentioned discovery. We can discover models, traffic, do some data loss prevention. So there's a number of things and create this first level of visibility. Beyond that, we also do what's called security posture management. So you're using a development platform, please make sure the passwords are set up correctly. Make sure the right people are accessing it. It sounds almost mundane. But this is, it's a new tools. Make sure you're setting them up correctly. There's a lot we do around red teaming, particularly with models. So adversarial testing, throwing everything we can at it seeing if there is some propensity for it to misbehave or do strange things. That's not a guarantee that it won't in production, but it's a best practice. Also look for model drift. These are dynamic tools, so they're changing. And then monitoring this during runtime. Especially organizations that have built AI tools or have custom AI tools or adapted the models, got to keep your eye on them. So you've got to make sure they're not doing strange things. The comment, it's not really a joke, but people saying, hallucinations are a feature, not a bug. By its nature, it does unexpected things. So you have to have reasonable controls around that. But, we frame it in terms of enabling AI, not blocking it.
Interesting. Manmohan, how do HIPAA and other regs influence your approach to AI risk management?
Yeah, no, so we definitely take HIPAA as a baseline, right, so to say, because again, it's, HIPAA sort of defines that sort of guardrails around how do you capture, process, and disclose patient health information. So we really use it as a foundation for evaluating these use cases. Again, going back to the point, what type of PHI data we are looking at, right? We challenge the users to say, can we de-identify that data so that we don't have to deal with any potential disclosure or a breach, so to say, if at all it happens, right? So that's like more our foundation, but we sort of top that up with some of those local Texas and federal regulations as well, right? So there's been few executive orders, in Texas. There's a House Bill 127, which talks about proper use and governance of AI. Executive Order 48 talks about using some restrictive and prohibitive technologies, especially from countries of concern. So we sort of bring that up as well and say, okay, what model are we using? Again, we have limitations to some of those open source models, right? There are some requirements coming in from that. So we kind of take all of that and really build, and we look at more like a NIST AI framework, and we kind of build evaluation process based on that. But that's how we sort of balance it, right? Again, HIPAA specifically doesn't talk about how you handle AI technologies, right? It does talks about technical safeguards that we use as a foundation. But I'm sure with a fast change of how we see this coming, I'm sure we're not too far away. Then we'll have a very focused regulation, especially focused on patient data, so to say. But that's how we're sort of balancing it.
Just want to add one more thing you mentioned. I think we are definitely believe in frameworks, which are emerging. OWASP has the one for top 10 LLM risks. Yeah. The NIST AI, RMF, MITRE has their Atlas. So we have embedded all of these and map everything we can find to these frameworks, because we've got to start talking the same language.
Absolutely. Oh, cool. Yeah. All right. Final thoughts. What's one piece of advice you would share with orgs that are looking at AI today, with healthcare orgs?
Yeah, I'll give sort of three pieces of advice rather than one.
Three will do.
First is set up that foundation. That's very important, right? Build a framework, have that committee, bring in representation from everyone, have everyone sit on the table. And to my earlier point, don't just run behind AI, right? Think about it. What are your pain points? What use case you're looking at, and how it's going to value you, right? And do it sort of with a more defined framework, so to say, with representation from and cross collaboration from all the stakeholders. Second is definitely shift left in security, right? I mean, we've been talking this is not AI specific, but it's always, we've been talking shift left for like a couple of decades now. But yeah, bring security and compliance early to the process, right? And that's something I think we've done really well, is we have them seat at the table, not just at, okay, we have built something, can you go ahead and test it, right? It should be sort of earlier in the process. And last but not the least, is having effective governance over what AI use, on shadow AI predominantly, right? Because as much as we know, shadow AI is not only about what is getting built by your employees or things. In your institution, one of the areas we've been looking at is every technology either has or is working on an AI component, right? and you, without knowing, there will be some Gen AI use case thrown into the tool, and when you upgrade it, especially when you're SaaS, you don't control it, right? In SaaS, they will just upgrade your instance, and you don't even know you're actually leveraging an AI capability, so to say. So having more enforcement on the whole procurement, a tighter procurement process, ensuring as things are updated, you are in the loop doing respective security reviews. I think that's sort of critical because that's a good area where, without having enough governance, AI would sneak into your environment and you won't even know about it. So
I think ditto to everything you said. I'd add one more wrinkle, which is don't create a new security silo around AI. As an industry, we've been guilty of adding new tools, new different players. Silos are a huge problem. A lack of just basic collaboration between teams, sending spreadsheets instead of looking at the same dashboard. The real risk now, we have, light up the dashboard with all kinds of new AI findings. They've got to be put in the context of everything you already know how to cover. What are they connected to? How do you correlate them? So, we're firm believers in whatever we do, whatever we discover has to be integrated into your security, your holistic security processes. Otherwise, we're just creating more headaches, and we're not going to have the staff to just manually plow through this. So we've got to think ahead of that.
Absolutely, agree.
All right. I would like to thank our guests, Willy Leichter of PointGuard AI and Manmohan Singh of the UT Southwestern Medical Center, for their great insights today. Thank you both for being here.
Thank you, Paul. Great discussion. Really appreciate it. Thank you, Manmohan.
Yeah, absolutely appreciate it. Thanks for having us.